So today we're going to talk about breastfeeding and kind of how that relates to physical therapy. So just a quick disclaimer, I'm not a lactation consultant, so this isn't necessarily breastfeeding advice per se. And this isn't individual medical advice while I am a licensed physical therapist. I'm not doing an evaluation on you, so this does not replace an evaluation by a licensed healthcare professional, whether that be a physical therapist or a lactation consultant or a physician. So like I said, the purpose of this webinar is to go over postures and other tips that will help support successful breastfeeding. So why is posture important? Posture during breastfeeding is super important because it can help us to avoid all kinds of issues like pelvic girdle pain, carpal tunnel, low back pain, neck pain, headaches, shoulder pain, pretty much pain anywhere in the body we can start to have. If you think about breastfeeding, we are sitting in that posture long periods of time constantly throughout the day. So if we have poor posture, that can lead to lots of movement dysfunctions over time because we're spending so much time breastfeeding. So just a few tips depending on there's different positions you can breastfeed in. So depending on what position you are, you still want to follow all these tips. So with your back, you want to keep your spine neutral. So you don't want to overarch your back, but you don't want it to be real flex forward and slouch forward either. You want to use pillows to your advantage. So you may find that you're laying in a position and you have 4 pillows helping you support, but that's great because instead of putting that extra stress on your body, now those pillows are doing that job for you. As far as the baby goes, a general rule of thumb is going to be to bring the baby to the breast, not the breast to the baby. So you want to bring the baby this way versus leaning forward and going to the baby. And then your neck is a really common one too. A lot of times when we're breastfeeding, we're holding the baby and we want to look down at the baby. Now that's not to say you can never look down, but you don't want to spend that whole time looking down. Be sure that you're just aware of how long you're spending in that posture looking down. So let's talk a little bit about the different positions. So these 2 pictures are kind of positions that maybe aren't the most ideal. So if we start with this picture here on the left, you can kind of see, what just happened? This picture, you can see that her body is kind of twisted a little bit. She doesn't have that neutral alignment in her spine. She's kind of holding the baby awkwardly. And it's just not a good fit. Ideally, she would be sitting up nice and tall. She'd have her back against something, maybe a pillow to help hold that baby up and support the baby so that she's not having to twist her body down this way. The other picture here on the right, nothing necessarily wrong with this. Her posture and everything does look good, but her baby's little. As the baby starts to get heavier and heavier, she's going to have to hold more and more weight for long periods of time. So ideally, she would get a pillow. You can just use a regular pillow. They make all kinds of different breastfeeding pillows like the Boppy, things like that. That way your muscles aren't having to hold over that long period of time. You can use this as a time to relax a little bit and let your body rest. So let's go over just some different positions that you can use. So this is the cradle hold. This is a pretty common one. You can see here that she's sitting in a pretty neutral position. She's bringing the baby to her and she's using this pillow here to really support her. She's able to use her hand here and relax her forearm there, but also to kind of cradle the baby's head and hold the baby this way. So this is a really nice position. Sometimes with sitting, that can be irritating if you have any kind of tearing, any episiotomy, perineal tearing, if you have issues with your tailbone after delivery. So these kinds of positions might not be the best. Another one is the football hold. So essentially it's like you've got a football here and you're holding, but the football is your baby. The nice thing about this is if you have multiples like twins, you can actually feed both at the same time because they won't be hitting each other like they would be in that cradle hold. This is also really good for women who have larger breasts or if their nipples are inverted. And then sometimes I also use it to get a better latch for babies that have an incomplete cleft or that palate lip. So this is a nice position. Same thing here, you can see she's using that pillow to really help support her. She's sitting up nice and straight. She's not leaning forward to come to the baby. She's brought the baby to her using that pillow for support. She's got her back nice and supported there too. And then you have the upright hold. So with the upright hold, you're going to place the baby on your lap like this. Depending on the size of the baby and the comfort, you might want to use a pillow. She is sitting on the floor. That's maybe not the most ideal position, but she is staying in nice, good alignment. This position with the upright, it can be helpful for the baby to swallow and prevent choking. And then it's also good for babies with reflux because they're not laying down to get that reflux to come back up. They're sitting up using gravity to help bring things down into the stomach. So that's the upright hold position. And then the sideline position. So this is a really nice position for a lot of different things, whether you've had a cesarean section and that scar is pretty tender. If it is, I will say, see a physical therapist once you get clearance from your physician so that they can start to work on myofascial techniques and things so that you don't get lots of adhesions in the abdomen. But that's a whole another topic for another day. But this position is so good for cesarean. If you're tired, it's nice because you can lay down. So at nighttime, if you don't want to get up and have to sit in a chair, it's great for things like tailbone pain because you aren't putting all that pressure on your tailbone as you're sitting. You can put the baby on a pillow. I like this picture because she's using lots of pillows to her advantage. So she's got a pillow here in between her knees supporting her. She's got a pillow so that her neck is in a nice neutral position and not falling down towards the bed. She could, depending on how comfortable the baby is, put a pillow under the baby to kind of lift the baby up towards her breast. So when you are breastfeeding, there's a little bit of difference in the hormones of your body versus if you weren't. So prolactin is a big hormone with breastfeeding, and that's the one that actually helps to promote the milk production in the breast tissue. And while prolactin can affect and inhibit the hormones that are necessary for ovulation and reproduction, it's not a guarantee. And breastfeeding should not be used as a form of birth control. You can definitely become pregnant again, even if you're breastfeeding. It's a wives' tale that you cannot get pregnant while breastfeeding. Another hormone that's really important is going to be estrogen. So as you're breastfeeding, your estrogen levels are a little bit lower. Estrogen is going to help keep blood flow, and it's super important when we're talking about the pelvic floor tissue or the pelvic floor muscles. And if your estrogen is a little bit lower, you're going to just have decreased lubrication naturally. Your vaginal tissue might be a little bit more sensitive, and you might have some pelvic floor muscle issues like incontinence or prolapse. I will say, when you get the clearance from a provider to go back to intimacy with your partner post baby and you're breastfeeding, it can be very helpful to use a lubricant, but not all lubricants are created equally. So like KY jelly and stuff that you might find on the shelf of a grocery store, maybe not the best. See if you can find a water-based or an oil-based lubricant. Sometimes things like coconut oil work just fine, just as long as you're not sharing the coconut oil in your kitchen and the coconut oil in the bedroom. Those need to be two separate containers. But if you are having pelvic floor issues like incontinence or prolapse, I highly suggest seeing a pelvic floor physical therapist so that they can help you to continue breastfeeding, but also help to manage these symptoms and get your pelvic floor working the best way it can. When we're talking about exercise and breastfeeding, they can definitely happen at the same time, but it's important to remember that breastfeeding alone is going to need about an extra 500 calories per day. So if you start to get back to exercising and you notice that your milk supply maybe isn't keeping up with what your baby needs, it could be that you're not eating enough calories. Hydration is also super important too, because your body uses all that water that you drink to help fuel the baby and create milk. So you want to make sure you're getting enough water for yourself and for milk production. Now, like I said before, we spend a lot of time working on breastfeeding. And that's can be overwhelming sometimes, but we can use this time to our advantage. So once you get set up in a nice, good position with your baby, Here's some things that you can work on while the baby's feeding. So you can work on some neck stretches, which I'll show you some in a little bit. Work on diaphragmatic breathing. Breathing is super important for a healthy pelvic floor. So practice on, as you breathe in, the belly should kind of gently draw out or come out this way. And then as you breathe out, the belly should come back down. Practicing that breathing is great starting the same day as labor and delivery. You don't need to wait to practice that. When you're doing it, you can even kind of pay attention to your chest and see, is your chest rising up and down? It might move a little bit, but we want a majority of that motion as you breathe in to come out through the belly. The other thing that you can practice while breastfeeding is going to be contracting and relaxing your pelvic floor. So just feeling kind of what it feels like to squeeze and relax. It's really important, not only that squeeze, but the relaxing is just as important so that we're not tightening and tightening and tightening, because a tight pelvic floor doesn't necessarily mean a strong pelvic floor. Just like your hand, if your hand was stuck like this, that wouldn't be functional. We need to be able to open and close. We need to be able to contract and relax the pelvic floor for it to work the way it was designed to. So now I'm going to go over just a few stretches or exercises that we can do to help kind of alleviate some of those pains that we might get with breastfeeding. So a lot of times we get a lot of neck and back pain, shoulder pain. So this first exercise is a cat-cow. So you're just going to coordinate with your breath and go between these two positions. So this would be the cat and this is the cow position. It's not super important. Just pick one way to inhale and the other way to exhale. So I might come into this position as I inhale and this position as I exhale, whatever feels the best for you. Try doing about 10 to 20 repetitions of this. This is really good for getting mobility in your thoracic spine here. Can help with the hips just a little bit. Another one is open book. This is also good for the not the pelvic floor. I'm a pelvic floor therapist, can you tell? This one is also good for the thoracic spine. So you're going to start in this position here in the top picture where he's laying on his side. And then you're going to keep your hips and your knees stacked on top of each other, but rotate your upper body and open up that arm. Hold it for just a second or two and come back. Same thing, 10 to 20 repetitions on each side. The pec stretch. So our pecs are right here in the front of our chest. A lot of times when we're in this slouched forward posture, those muscles get really tight. So we want to stretch them out a little bit. There's a couple different ways you can do this. You don't have to do it on the ball. You can just lay like this on the bed and feel a good stretch. If that doesn't feel like much of a stretch, you can add something under your back, whether that be a foam roller or a pillow, kind of along your spine so that your arms can fall back just a little bit more. It lifts up the spine to let your arms fall. You can also do it like in the doorway, like this lady's doing here in the picture, just gently leaning forward. The nice thing about this is you can control a little bit better how much of a stretch you're getting by how far forward you lean. You can also play around a little bit with your arms up and down the wall like this. You might find that you find a better stretch higher or a better stretch lower. Wherever you feel that nice stretch is good. With a stretch, you want to try to hold it 30 to 60 seconds if you can. That way we actually get lengthening of those muscle fibers. And then the scap squeeze. This is a good one for posture. So in this picture, he's taking his shoulder blades here and he's kind of squeezing them down and together. As you're breastfeeding, you can practice this, just squeezing those shoulder blades together, hold for just a second or two and relax. Trying to do 10 to 20 reps of that. And here are some neck stretches that you can do. So the first one, she's just kind of looking down towards her armpit. When you do this, you should feel that along the neck on the opposite side. So if I'm looking towards my right armpit, I should feel that along the back side of, or the left side of my neck, kind of towards the back. This one here is going to be more of an upper trap stretch. So as you lean, bring your ear towards your shoulder. You should feel that on the opposite side. If my ear is coming towards my right shoulder, I should feel the stretch on the left side of my neck. The last one here is a scalene stretch. So you want to bring your neck or your ear towards your shoulder and then kind of rotate and look up towards the opposite direction. You should feel a stretch towards the front. So if I'm leaning my head towards the left, I should feel that stretch on the right front side of my neck. With the neck, you can also just do some gentle range of motion exercises. So looking side to side, looking up and down, ear to your shoulder, just gently Same thing, try 10 to 20 repetitions and see how that feels. I will say that no exercises that you do should be painful at all. If they are, stop and don't do them. And if you have any issues, like you have neck problems, if you have shoulder problems already, or if looking over your shoulder makes you dizzy or gives you double vision, it's important to go talk with a provider. Now, resources, as far as breastfeeding goes, there's all kinds. A lactation consultant can be a super great resource. Sometimes it's covered by insurance also. So talk with your OB or your midwife. They might know of lactation consultants. You can also just Google, find a lactation consultant near me. La Leche League is another really good organization. That's all about breastfeeding and helping women so that they can breastfeed. You can go to womenshealth.gov/breastfeeding, and they have all kinds of resources. They also have links to other not societies, other organizations that they recommend. And then if you're having any of that musculoskeletal pain, find a pelvic or a physical therapist near you, preferably somebody who has training in pregnancy and postpartum. But if not, a regular PT should still be able to help you with any kind of shoulder, back pain that you might be having. So if you have any questions, you can call me. My website is there. My Facebook is there. You can email wingsphysiotherapy@gmail.com, or even on Instagram. Dr. Mtastic is my screen name. I'm always posting all kinds of educational stuff there in reference to pregnancy, postpartum, the pelvic floor, getting back to exercise. So yeah, any questions, feel free to reach out to me. I'd be more than happy to help.